faculty is bringing together a significant amount of expertise from the whole of the NHS to deliver a programme of work that will deliver sustained improvements to improve the outcomes for our patients across the whole service.
Well, this is a group of very experienced people, very knowledgeable about the NHS. They have experience in many different organisations, and they have a shared vision about promoting improvements in quality across the NHS.
By bringing those experts together, they're able to define areas where the service can improve, utilise the best evidence available from both the NHS and also internationally to ensure that we're able to support the front line in delivering changes that improve outcomes for our patients.
Faculty's role is to understand a little bit more about how it is for frontline teams to listen. Undoubtedly a group of people with particular skills and expertise, and I think if we come to that work willing to be more collaborative, share what's good and support teams, and that's a great resource for those teams to draw on.
It's important that we have a system that supports our staff to do the right things every time they work with patients. We know that we need to do more for less. We know that we need to keep up with the rapid advance of healthcare delivery in other parts of the world. And so our challenge for us is absolutely desperate about how we can improve.
I think one of the most important roles the faculty can play is remind NHS improvement in the system and partners that healthcare is fundamentally a local activity. And the best thing that system stewards can do is help put in place the conditions that support improvement locally. That might be about giving people access to good examples of good practice, it might be about supporting people to build their capability, knowledge and confidence, or it might be about recognising that most national and international experience shows that improvement takes some time and constancy of purpose over time in order to deliver really transformative results.
We have to ensure that the people who make up the Faculty of Improvement see this as a long-term enterprise, not just another short-term initiative. And having this group of senior people with a shared vision and with a commitment to a long-term effort, I think can make a profound difference.
I think this Faculty of Improvement has brought together a whole range of skillful people who have got track record in having done it. And one of the things that really cuts the mustard in the NHS is being talked to by people who've been there and done it rather than someone who's just got a degree in it. We need to become learning organisations. We've got to make headroom for people who can think of new ways of doing things and protect them and allow them to change and try different approaches that will bring a more efficient and more effective service.
The best piece of advice I can give to the people in our service is always focusing on the patient. They are absolutely key to ensure that each of our programmes of improvement are focused in on improving outcomes for them, their families and our communities.
Quality improvement is best done in teams, so we need to build really effective teams focused on delivering quality improvements, and those teams should take time out on a regular basis to review what it is they want to improve and how to go about it.
I'd say seek out like-minded colleagues, seek out the resources that are available. The Health Foundation produces a quick guide to quality improvement. There are all sorts of resources that are out there to help. It's very, very tough, but you're not alone, and there's a lot of people out there that want to help and want to help you make the difference.
My aspiration, my hope, is that it creates the opportunity for us to have a much more dynamic conversation with our staff across the NHS, so that our staff feel supported by a leadership that is committed to helping them improve, but also helping them create the conditions by which they can improve.
The NHS is an outstanding organisation that delivers every single day for millions of patients. The Improvement Faculty give us the opportunity to ensure that we are the very best in the world.